Right, I think you spoke to my colleague Dr. Sayer earlier on today and saying you're really low in mood. What's going on?
I don't know, like literally for the past couple of days, I can't leave the bed, like I had to leave work. And I'm suffering from really bad anxiety. As soon as I get into public places, I can't breathe.
Okay. Is this something you've had before?
I used to have really bad depression, like from when I was 17, I got diagnosed with it, but lately it's just coming back. Like I don't want to leave the bed, I can't eat, I'm not.
So nothing's changed in life or nothing new, it's just...
Literally, I woke up and I didn't want to leave the bed. I feel like I'm scared of something, but I don't know what I'm scared of.
Are you taking anything for it?
I stopped taking them ages ago, but I don't know what triggered it or what's sort of going on.
All right, well, we need to sort this out here. Why don't we give you a bit of time off work so that way you don't have to keep
I'm just worried because obviously I'm new to there and I don't want it to be a thing where they fire me, but I literally can't, like... Earlier on when I called in, I literally felt like everything was about to fall on me. My chest got tight and I had to literally like strip myself in the bathroom because I didn't know what was going on. Like I felt like the walls were sort of caving in on me, and I've never had anxiety. I've never ever suffered with it. It's never happened to me before.
Have you got anyone at home with you?
I live with my nan, but it's like I don't want to stress her because she forgets things anyway, so it's really bad.
We'll sort this out. It's all right. We'll sort this out. With regards to work, I don't know what you'd prefer because you can take self-certified for 5 days. That way you can say whatever you want to say.
Well, like, I might need a few days just to gather myself. And it's something that's documented that I've struggled with for years. But right now I'm scared that it's only going to get worse.
Okay. All right.
When I was younger, I would literally lock myself in the bathroom and they would have to call, like, the police and stuff to come and get me out. And I don't want to go back.
We won't go back to that. We won't. It's all right. We're not going to go back to that. We're going to sort this out, all right? Sounds like we need to start you back on something again, and maybe get you in touch with some counselling again. Have you had counselling in the past, yeah? Okay, well, look, most people have started on either sertraline or citalopram.
That's the one I had before.
Would you like to try that one again, or would you like to try something different?
I think I might want to try something, only because when I started on that, it's like it got worse before it got better, and it wasn't.
Yeah, it can, just warning you, all of them generally make things a little bit worse to start with, but let's try the new one anyway. But just to warn you, though, those first 2 weeks generally make you feel a bit more rubbish. There are other things like propranolol and diazepam that you can kind of take if you're getting a bad panic attack. Problem with diazepam is it is addictive in nature, so it's the kind of thing we can only really give you kind of a few tablets of. Or there's propranolol, which helps like slow down your heart rate and stops that whole like fluttering thing. They're not addictive necessarily, but it's not something you want to be on long term. It's just maybe might help at the moment whilst you're feeling so panicky. Would you like to try either of those? Yeah. Do you have a preference of which one, or you're happy to give either one a go? Okay, let's try propranolol as well. Oh, have you got asthma?
Yeah.
I just wonder, because propranolol, it can sometimes make asthma a bit worse, and so I don't really want to give it to you if your asthma might get triggered off, so I'm not going to use that one. All right, if I give you 7 tablets of the diazepam, I said they can be addictive, so please just be careful. I only take it if it's really bad. Okay. Now I'm going to just give you a telephone number to get counselling as well, okay? All right, so give them a call as soon as possible. And come see me again in 2 weeks, having started all of this. Obviously, if things get worse in the meantime, just call us, okay, like you did today. If things don't improve, just give me a call.
Perfect, thank you so much.
That's all right. Good luck with all, okay? Let us know how it goes.
So your asthma is not good?
No, it doesn't feel too great. I just feel really kind of just tight.
You sound terrible. Yeah. How long have you been like this for?
It was bad last week, and it felt a bit better. And then, probably, I think, Friday last week, it felt not so good. And
how many puffs have you had today?
About 6.
Okay, I'm going to get you a nebulizer now, so that we can talk a bit more, okay? I might need to come and sit here, so you're next to the... I can plug this in. When ready, I'm just going to plug it in for you. You feel it coming? Okay, so just some nice deep breaths for me, okay? How long have you been breathing this fast for? Today and is today? I think we're probably going to need to send you in because we're not winning. You're at that point now where potentially you could get so exhausted that you'd find it hard to breathe at all. I'm going to get reception to call an ambulance, all right? Just going to have the door open, just in case you need us. Can we get an ambulance now? Blue lights, yes, please.
For now?
Yep.
What's wrong with them?
Room 6, severe asthma attack.
Severe asthma attack.
She's got respiratory rate is 60, despite a nebulizer tell them, so they need to come in now. If someone comes in an emergency situation, the sort of human instinct is to panic, but this is what we're trained for. And I have worked in A&E, and we are GPs, we are very highly skilled. So although it doesn't happen as often in general practice, it still happens frequently. So your adrenaline is pumping, but you don't panic. You need to stay calm because you need to assess the situation, work out what needs to be done immediately, because there's lots of jobs to be done and it needs to be done quickly, but safely and calmly. She's on 40 milligrams of prednisolone, has been for 7 days, and things have got worse rather than better. So we're back at our limit again for what we can do in the community. Thanks ever so much. Okay, bye-bye. Bye-bye. Hi. All right, my lovey. Hi. So this is Miss Gorey, who's a known brittle asthmatic. She's normally on 10 milligrams of prednisolone every day, but she's been on 40 milligrams for 7 days. Despite which we haven't really got on top, as you can see. So this is after a 5 milligram nebulizer. She's still got a respiratory rate of 60. All right, I hope it gets better soon. Okay. Thanks, guys. No. Thank you. All right, thank you, guys. Good luck. Take care. Poor love, she's just breathing. Oh, she's terrible. So fast. Really frightens me when they're that bad, because, anyway, poor love. Relief in one sense when the door closes and the patient's gone with the ambulance crew, they're safe, they're going to hospital, that's what needs to happen. Sometimes a sense of kind of, not anticlimax, but almost, because you've had all this adrenaline, everyone's been rushing around, we've looked after the patients to the best of our ability, and now they're in someone else's care. But actually, you then have to take a deep breath and realise that probably you're running late, because this has taken, understandably, way more than 10 minutes, potentially 20, 30, 40 minutes. So then you kind of take a deep breath and have to face the day explaining to everyone. Hopefully, most patients understand, but it can be quite stressful then.
Are you going to tell us what's the problem, or are we going to leave it to your dad?
I don't know what the problem is. Mummy mine, I know what the problem is. So when I was at school and the door was open and it got really cold, then I was cold, so I put my jumper on, but that didn't work.
Oh, okay.
But everybody else was in t-shirt, weren't they?
Yeah.
So you were feeling cold, were you? Because I mean, it's been sunny the last few days, hasn't it? So, do you feel any pain or soreness or?
I'm okay.
You're okay, yeah, fine. Can I get your dad's take on things?
Yes,
See what he reckons.
Obviously, they saw him putting on the coat when everybody else was sweating, so they took his temperature and he was very hot.
Okay.
They gave him some medicine, but as soon as the medicine wore off, he spiked again.
Yep. I was wondering if it might be possible to have a little wee for me. Let me give you a pop.
That's so little.
I know.
That's too little.
It's practice, isn't it? I'll set you that task if I may. Any success? Oh, look at that. What I'll do is I'll just dip my little bit of paper. It's quite clever stuff, really.
That easy, isn't it, Dad?
Yeah.
It's easy being a doctor. Okay, there's no urine infection.
Okay.
I think where it's coming from, it's a viral infection of the upper respiratory tract, and there's a tiniest little bit of redness in the ear at the back of the throat, and he's got a few lymph nodes up there. It's almost certainly going to settle down on its own.
Okay.
So it's just a question of keeping an eye on him over the weekend. So keep him well hydrated, Calpol's absolutely fine. These kind of things usually take between about 5 and 7 days to settle down completely.
Cheers, thank you.
Have you got any questions for me?
Have you got any stickers?
Right, what are you going to have?
Bye, Dada.
Okay, cheers, thank you very much.
Nice to see you, babe.
Thank you.
Take care.
Thanks a lot. Cheers.
Pleasure.
Bye.
Bye, take care.
That was easy, wasn't it, Sam? That was easy.
Yes, well, it wasn't a test. He's just trying to make sure that you're okay.
Yeah.
Hello, Miss Morey. Hi. How are you?
I'm not too bad now.
Okay.
If I have something to eat and then I have to go and pass a stall,
Yeah.
the pain that I get, it's like you're open, but you're not closing up. I don't know, like it hurts a bit.
But no bleeding from the back passage or anything like that?
No. It can happen, but that's very, very rare.
Okay.
That's just rare, that is.
And we spoke last week, obviously, about alcohol as well.
Oh, yes.
And that's still something you're taking daily?
Not daily, but
Yeah.
every other day or every 3 days. Yeah, I do. And my roll-up cigarettes.
Yeah.
You know. Personally, Doctor, I can't see that changing, really. The only other thing I can say is my diet is very, very poor.
Yeah.
Because I do not stick to a proper diet. I can have, say, a couple of boiled eggs and toast, 2 cups of tea. That can do me for 3 to 4 days.
Yeah.
I don't want anything else. I have no desire for it.
And you said last week, there wasn't any problems with any food sticking or anything like that?
No.
No problems with swallowing?
No.
And obviously you haven't got a huge amount of weight on you?
No.
But you hadn't lost any weight or anything like that?
No, not to my knowledge. No.
Not to your knowledge. Given the fact that you smoke a fair bit and drink a few times a week, we know that there's an increased risk of things going on in the stomach, and that includes things like stomach cancers. Okay.
Yeah, I've thought about that.
Yeah.
It won't hit me like a ton of bricks if I find out something like that. I've had a good innings.
Yeah. But I think we should investigate that a little bit further. Even without those blood results to look at, I think we should be referring through to the hospital for somebody to pop a scope into the stomach to have a look. What do you think about that?
Yes, but why not?
Because we've talked about things like stomach cancer, it's something that the NHS really does investigate very quickly and very comprehensively. Do you think that's something that we should refer you for?
Yes, I think so, Doctor.
Yeah. I think that's important.
Okay, then.
Hi. Oh, careful. Sorry you had to walk a bit further down. How do you think I feel?
Oh.
Been a while since I've seen you, hasn't it?
Yeah.
Lucky you.
I know. Let's hope I'm going to be bloody lucky now.
Have you missed me?
Oh, yeah. Well, I miss you, but not coming around here.
Can we do your left arm? Because I know from previous...
I know.
I think I know your arm better than you do.
You don't. Well, that went in nice.
Didn't even feel it, did you?
No, I didn't. See, that's why I like you.
That the only reason?
No, I like you as a
I was going to
person,
say...
And as soon as you got that colour...
using me for my blood technique.
You definitely.
You like my hair colour then, he said?
Yes, I do. I used to be that colour when I was young. A natural colour, though, it was, until I...
Have you ever seen my natural hair colour?
No. Black. Brown.
Ginger.
Ginger? Not a bit of an Irishman, are you? Any holiday yet?
Yeah, I'm going away in 2 weeks. Where do you think?
Turkey.
There you go. You know me so well. GP surgeries do become like an extended family for elderly people because they do come in a lot more than some younger people. So they do get to see, like me, a healthcare assistant, a doctor and a nurse. So, and they have different relationships with all of us. So that is like a family in itself. So I'm probably like the little naughty grandson, and then one of the nurses could be this, you know, that's how they see it. And it's like a day trip for some of them as well. They get a bus in together, some of them, so yeah, it's quite sweet.
Well, my niece got married, not last week, the week before, in Spain. So I've got another one getting married in Spain next year.
Are you going?
No, I never went to this one. I said, I won't be able to come to that. We'll get you a wheelchair at the airport. He said, we'll get you there. But
I need a wheelchair at the airport as well.
I need a wheel. I need everything at the bleeding airport.
By the time I'm done on the plane, I need one.
Taxi there and taxi back and
Oh,
comfort.
lady of leisure.
Definitely.
Look at you.
Well, you know why I say I might as well spend it because they'll spend it when I'm gone. Nice seeing you.
Oh, you too. Always lovely to see you. Take care.
Will do.
You got a paper?
Yeah.
I want that crossword finished by the time I come out there.
Yes, take it home with me.
Thief.
Bye-bye.
See ya. Even from when I was on reception, I always thought, try and make somebody leave here happy, because you never know what they're going in to see the doctor for. It could be anything from bereavement to cancer. So making somebody's time here happy, I've always thought is very important.
What can I do to help?
I had some fertility tests last year, and I got given the results. It was when I was with my ex-girlfriend. I went to a specialist, and he explained that I was kind of slightly below average, but in normal parameters. But then when she went back, there's another doctor that she spoke to who said, no, the specialist is wrong. You need to get a second opinion. And they said, yeah, those results are on your record, so you could explain them to me.
Right. So we're wondering if you do or don't have a problem with your sperm.
We are, yeah.
OK. I've got a set of sperm results from the 1st of May.
I mean, looking at some of those numbers to me, obviously it looks devastating when you look at the low figures.
There are two numbers which are not as high as we want them to be. The first is the number of sperm which are swimming in the right direction. And what you want is more than 32% of sperm to be swimming in the right direction. And only 21% of yours are.
Right.
The other thing which is not ideal is this number of normal forms. What that means is they look down the microscope at the sperm and see if they're the right shape.
Yeah.
They didn't see any of yours which were the right shape. So I guess we've got a couple of choices. I think there is a lot of variation in these samples, so you could do a third test. Another option is for me to contact a urologist and give them all the numbers and say, what's the situation? This is one interpretation. What does this actually mean?
OK. Well, that's definitely the first step for me. And can he give me more of a breakdown as opposed to just a, you know, I don't know, just sort of more of an explanation, because I still don't really understand that.
What would, in an ideal world, what would you want them to be able to say?
I want to say you've got this percentage chance.
Of having a kid?
Yeah.
OK.
I think anyone in their right mind would want to know.
Yeah.
I want to have an idea.
Yes, I understand where you're coming from.
You've been in hospital, you had your tonsils taken out first of all. One, the right side, yes.
The right side, and I'm too beg your pardon, sorry.
That's okay.
It's been in constant pain ever since, and then about 3 or 4 days later, I just cleared my throat and an enormous volume of blood suddenly appeared.
Oh my goodness, okay.
So we had to call the 999, taken back to the hospital.
Thank you, Bridget. Okay.
Initially I was scared it might be an internal, but it wasn't. The bleeding was actually
from there.
From there.
Okay. So you've got here, you're seeing the Royal Marsden Hospital this Thursday, okay.
He's going to have, I think it's 20-something, lots of radiation.
Yeah.
And then the second for 5 days a week for 6 weeks.
Okay.
And he's also going to have chemotherapy.
That's a lot.
Just a damp sore throat, that's the known bit.
Okay, so it's the pain that's the biggest issue for you at the moment.
It can be, especially at night time.
You're on the omeprazole, the propranolol,
Yes.
The calcium and the vitamin D, and then the bone alendronic acid once a week. And then importantly, painkiller-wise, is the cocodamol. If it's difficult swallowing tablets, do you want to keep it as a tablet form?
I prefer, I had a choice of that or up my bum.
Oh, John.
I did. So I quickly learned how to swallow.
As an alternative, a third option You could have dissolvable tablets or liquid.
No, I'll stick with the tablets.
The tablets. You're okay swallowing
absolutely.
them? You can make them a little bit stronger if you want.
Just slightly stronger.
Slightly stronger, yeah.
But again, just for the occasional rise.
Just for the occasional, yeah.
Absolutely, no other reason.
What else do you need to...
No.
Yeah.
My sister, one of my sisters, she's critically ill in Ireland.
You told me on the phone, yeah.
Charles is my first priority, obviously. I can't leave him at all, and I wouldn't. But I need to go over to Ireland if I can. If Charles's sister came and stayed, which she will, all the time in the house with Charles while I'm away, do you think that is...
I think that's fine.
It is.
I think that's absolutely fine, completely. Yeah. If Charles was happy with
absolutely.
it.
Yeah. Absolutely.
And you have...
Absolutely, of course.
It would only be for 2 days.
Okay. You know, your sister, she's very unwell, she sounds... And you need to...
Yeah.
You need to go over, and if you've got somebody... Not that Charles you need looking after, but I think it's nice to have somebody else there. You've had a very difficult time and you're going through a lot, and if your sister can come and help... I'm a very difficult patient. You're not a difficult patient. You're not at all. We would like to support carers as much as is possible. It's often a very unrecognised role. Across the UK, they estimate 6.5 million people are carers in some form or another to friends or family, which works out at 1.1 in every 8 adults in the UK. So it's a huge proportion of people. Often people might not recognise themselves that they are carers. They may be providing a caring role but not think of themselves as a carer. So one of our roles is to try and identify people who are providing a caring role and try and support them as much as we can. I think you're coping, from what I can tell, very well. And I know
good Lord, I've got a lot to do yet. Right, but we won't take
so,
any longer. Thank
okay,
you
no,
so
not
much
at all.
for your time.
Perhaps we could see you again maybe in about 2 or 3 weeks.
Oh,
we
great.
could do that.
Yeah,
and then,
that's very kind.
But anything in the meantime, I'm
You're
happy
so
to speak
kind.
Not at all.
Thank you very, very much indeed.
No, okay. All right, bless you. Oh. Okay.
Thank you.
All right.
Thank you for all your kindness.
You're very welcome.
Take care. See you soon.
Take care. So, okay.
Bye-bye.
Bye-bye. All right.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This has actually found a way to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. And he had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, the sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath and he just went. His eyes and his backwards. And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. Oh. I'm out, but I just thought, what am I going to do? But anyway, I know, but I'll be all right, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a carers association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling. And I think that's an important outlet for her.
Hello.
Hello, Bridget, how are you?
Not too bad. Could you give me a printout? Oh, I think he needs tablets too.
This has actually found a way to Portugal.
Oh, thank you.
That's your missing link.
That's lovely.
You know how long
I nearly lost Charles on Wednesday. He had a massive bleed out. And he had to have 5 units of blood.
How are you?
I'm all right, I'm in bits, but he's in there now. He woke up and he said, Bridget, my nose is bleeding. He came down the whole of my bathroom, The sink, the bath, the walls, the floor. The paramedics never seen so much blood. And the paramedics thought he was gone because he just went. Oh, Kim, I really thought I was gone myself. I couldn't bear it anymore. He is going to bleed again, and that's why because my sister is really ill in Ireland. I can't leave Charles on his own at all now. Oh my God, you never see the blood. And Charles was sitting on the side of the bath, and he just went. His eyes and his backwards. And the paramedics were saying, Charles, are you with us? Are you with us? And I was screaming, I love you, don't leave me. Oh. I'm out, but I just thought, you know, what am I going to do? But anyway, I know, but I'll be all right, you know, I have to be.
I hope that Bridget feels she is getting enough support, and I hope that she feels she would be able to speak to us or a Carers Association if she needed more support. We try and keep regular contact with her to ensure that she is okay and that Charles is okay. I think one of her strengths is she's able to be open with people about her feelings. She doesn't keep things closed in, and it's nice that she has a relationship with some of the staff at the surgery here where she can talk to people about how she's feeling, and I think that's an important outlet for her.
Mr. Morey, hi.
Hello, Doctor.
Hi, come in.
Thank you.
Come in, take a seat. Okay. And Miss Morey, how are you feeling?
Not good, Doctor.
No. Lots of problems throughout the tummy. Is there?
All round here. All this. Oh, it feels like I'm on fire.
Okay.
I tried to have some soup yesterday.
Yeah.
4 spoons, that was it.
Yeah.
I put the rest back into the fridge.
Okay.
I've got no desire.
Yeah.
I've got no desire to eat, and I'm tired of the pain. I'm fed up with it.
Did they talk to you when they did the endoscopy? Did the man that did the endoscopy talk to you about what they saw?
No, they just told me, they said a slight tear in the small intestine.
Okay.
I've got nothing for praise for those people.
Indeed.
They're very good.
Remember when we said that we were making the referral very urgently because we wanted to know what was going on with this symptom? That there's always the possibility of a cancer or something like that in the stomach.
Yes.
It did show something like that. It wasn't the typical sort of cancer that you see in the stomach. It was something else. It was a type of lymphoma. Okay. On the plus side, it's not one of the very aggressive things that happens. So I think that's the most important thing to think about at the moment.
Yeah.
Okay.
Whatever comes my way, comes my way. I knew this was a year for me.
Yeah.
I knew this was. I knew.
In what way?
This was the very year back in 1980 when my dad was my age now, 59, that he passed on. And now I'm 59.
Okay.
And I thought there was something in this.
Yeah. This type of cancer in your stomach isn't one that typically is very aggressive or anything like that.
But it is a cancer.
It is a type of cancer, yes.
Ah, right.
Okay.
I don't think they'll ever see me in work again now.
Okay, well, don't worry about work at the moment. Put that to the back of your mind. Okay? Let's focus on what's happening at the moment and what's going to happen next. So we got the letter from... Let me show you the letter from the hospital.
Yeah.
So...
I'll let you read it out, Doctor.
Yeah.
I can't look at the screen.
You take your time. Do you want a glass of water or anything?
I'll have a glass of water, please. Thank
Let me
you.
get you a glass of water. Just take a second. I'll be back in a moment.
Thank you.
There you go.
Thank you, Doctor.
No worries. I think it's difficult talking about these things as the general practitioner and not the hospital doctor because we don't have as much knowledge with the specific points around this.
Yeah.
But it's worth us talking about this today.
Yeah.
And then we can, be here to support you over the next weeks and months.
I mean, I've got to the point now where I don't really care.
Yeah. This is, as I say, it's not one of these very aggressive cancers. So it's not something that somebody needs to, go in and cut it out straight away or anything like that.
Oh no, not under the knife.
Nothing like that. Nothing like that. Okay. Take your time.
I've had illnesses before and I've had colds and things, and I've got over everything, but I'm not getting over this one.
No, this is one that you can get over. So this is not one of the very worrying types of cancer. So this is one of the things that is often very localised. It's very slow changing, and there are lots of treatment options for it. After a patient hears the word cancer in a consultation, they're not going to take on board much of what you're saying. It's obviously beneficial to try and provide some information about what might happen next, but we just know that at that point in time, they're not going to take on board much of what we're saying. Obviously, one of the great things about general practice is that we are there later that day, we're there tomorrow, the next day, and that we're easily accessible.
If the worst comes to the worst, with this, as John Wayne said, the big C, to quote, how long would it take to happen for me to,
No, it's not one of those things to think about at all at the moment. Obviously, these things go through your mind.
I'd rather know.
So this type
because I'm not feared of it.
Yeah. This type of cancer's very treatable. The problem with cancer is that it very much does feel like one condition, that this is cancer and it's terminal and this is the end of my life. Whereas in truth, there is so much variations between cancers, how early they're picked up, the types of cancer, that it becomes much more difficult to understand. And as soon as we use words like cancer, patients unfortunately always fear the worst.
I'm not going to drag myself all the way through this for a long period of time. As long as I know what is what, that's good.
Yeah.
Because I can prepare myself.
The difficulty is there's a lot of differences between each type of cancer. And therefore there's a lot of differences in outcome. Some cancers are very slow changing.
I'm not going to bleeding go through a long suffering process and whatnot, because I will tell you now straight.
Yeah.
I will tell you now. I'll make myself a cocktail, right? And I will go out overnight.
Okay.
I promise you. That's what I will do. Oh yeah. Make no mistake.
It's Maureen. Come on.
I don't want to waste anybody's time here.
You don't waste anybody's time. We're here for you. And we're, as I say, our door's always open. You can give me a call at any time when we're here.
Yes.
And I would always see you at short notice. What I want to suggest now is that it would be useful if you came back at lunchtime and then we had a chance, if you've got any more questions. Yeah.
Yes, I can make it.
Between now and then, I will have spoken to the consultant, and then we'll have a bit of a plan, and then we can get things going forwards together.
Okay then, Doctor Ed.
Okay.
If anything happens to me in the meantime or anything like that, please give my regards to Dr. Shard.
We're not thinking like this. We're not thinking. It's just.
Please give my regards to him.
Oh, come back and talk to me at 1 o'clock, and we'll have a bit more of a discussion about things, and we'll try and put things into more perspective.
Yeah.
At the moment, it's the more I talk, the less you'll take on board.
Yeah, I'll be in it then. I'll be in on time.
Yeah. Take some time. Come back in at 1 o'clock.
I will.
And I'll see you then.
I will, Dr. Len.
Okay.
Thank you very much for your time and your concern.
No, not
I
a problem at all,
appreciate
Mr. Roy. You know, these are the most important times.
Thank
and
you,
that's
Dr.
why
Len.
that's why we're here.
Thank you.
But
and if you see Dr. Shard, give him my regards.
I'll send you a regard. Pop in and see me at 1 o'clock.
I will do.
And we'll talk further.
I'll be here. I'll be here about 10 to 1.
Okay. See you then. Take care.
Thank you. Thank you.
Take care.
I'll see you soon. Thank you.
Indeed. See you then. Hi, Dr. Barker. It's William Laird. I've spoken to him about the results. He was quite distressed, so I'm quite a little bit on edge at the moment. But I hope he will come and see me at 1 o'clock. But then I'll panic a little bit if he doesn't. maybe I'll pop round the corner to see if he's at home. Yeah. Pleasure to talk to you once again. Thank you. Bye then. Bye. I think breaking bad news it's always a complex thing, whether or not you've known the patient for a matter of days or hours or months and years. It's just unpredictable how you're going to respond to this and how they're going to respond. And it's really just trying to provide information and let them know that you're there for them at their time of need.
Hello,
Hi.
Hannah. Come and have a seat.
Thank you.
How are you? What's happened?
I don't know, my eye, and this, I think I might have been a bit overdramatic coming straight to you, but one of my eyes, it just started, it felt like there was something in it, and I've spent ages putting my finger in it, which obviously hasn't helped, and then I thought that it seemed like there was something in it, but it looks like, I don't know, you look at it and you tell me.
Right.
It felt like there was maybe some, fluid, it was been really watery, but then it seemed like there was some creamy coloured...
Discharge.
Yeah, but not much.
Okay.
And then that bit there seemed really red, but I have poked it a lot because it was just literally, my eye was just watering because it just feels like there's something stuck in it.
Okay.
How does it look?
Looks okay. I'll have a look in more detail though.
Okay.
I'm just going to pull your eyelids down a little bit. Look up for me, and look left, and look right, and follow my finger with your eye. Okay, come and have a seat for me. So...
There's nothing wrong with it, is there?
Well, I can't see anything there.
Oh, okay.
I guess you've got this sensation of your eye being irritated and sore.
Does it look irritated?
No.
Honestly, not at all?
Not really, no.
Oh, I've just spent all morning looking at it. It feels like something here is like rubbing every time I'm moving my eye around, but obviously not enough for me to not want to move it. Do you know what I mean?
I do. I mean, if we were going to completely exclude a foreign body having scratched the front of your eye, I guess we would need to stain your eye with fluorescein and look at it under a blue light.
Yeah, that seems a bit much considering I feel like I've never rubbed, there was never an opportunity for something to actually go in it.
No.
Okay.
I agree, it feels like a bit much.
It does feel like a bit much.
Because your eye essentially looks completely fine.
Yeah.
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle, it turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, so the things like the laryngitis is typically more with the loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route or anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, It's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice? Or...
Going to Lisbon for a hen weekend.
Okay. Yeah. Hen weekend like this. No.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen. Let's have a listen on your back. If you is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where it was sort of...
I just had a sore tooth, but by the time I got there, it turned into like a wisdom tooth. And I just went, oh, nothing was open because it was Easter.
Yeah.
I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this hen weekend.
Can you say limiting?
Well,
realistically.
Do as you feel is right.
Okay. Is there anything else I can do?
Things, you know, sort of sometimes, you know, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It is just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you developed this infection.
All right, thank you
so, yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
Come and have a seat. I'm Dr. Beecroft. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
And just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. Okay. And I was just like, and I've tried everything that I can possibly get just over the counter, but nothing just seems to work anymore. And I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision and makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah blah blah, and it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them.
Yeah.
Out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good day. Bye.
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
Most terrible bruising I've ever seen.
And no other reason?
No, I don't remember.
No falling,
I mean,
no
you
injury,
know, I
no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly. Don't know what
Yes.
you know.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis?
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
the sun.
no more trips to
and a hat.
Ibiza.
No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Shaw.
Thank you very much indeed.
Bye-bye. See you.
And come and take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
And you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or...?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in that, in and
Yeah.
around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. I know I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here?
No.
Around the elbow? No. Okay. So I'm happy with everything bone-wise in
Yeah.
here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin. It's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here,
Yeah.
has just ended up around here. But the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just get it
What's
checked
it
out.
getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care. Have a good evening.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle. Like, go to the gym 4 times a week, eat really healthily. Like, I don't eat any overly refined carbohydrates or anything like that. Super healthy. However, in the past month, recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time, even if I'm only having a bowl of soup, just blows straight up and it feels really tender. Okay. And it's getting to the point it's just so uncomfortable. And at night, I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. Mm-hmm. So, accidentally had pasta last week. Mm-hmm. And literally I was sat there at work and I just couldn't do anything. When you're just all cramped up, it just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too soft?
No, like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I think my weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Does anything run in the family at all? Any bowel problems, celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Okay. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
So I started having a panic attack and thought, oh my God, maybe I've got ovarian cancer. Oh, because it really hurt.
No. I think your symptoms, a little bit like irritable bowel, what you're describing. Often people with irritable bowel tend to have some sort of bowel upset, so either diarrhea or constipation. You don't tend to have that.
No.
So it's more kind of just the bloating and things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I said,
and sometimes it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's exactly what I was confused.
So things that can cause bloating are apples and pears and artichokes and beetroot.
Absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect. Thank you so much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
keep looking
tend
like
to be
5 months pregnant everywhere I go because I'm so little as well. It just looks absolutely ridiculous.
Okay.
That's great. Thank you
All
so
right.
much.
Pleasure.
Thank you.
Okay.
I'm fine. What can
Be
I do?
asking that, should I? You should be asking me.
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards. I don't sleep. I'm lucky if I'm getting 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
They just, I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of
whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying, actually, apart from anything else, you're worried you wouldn't want to use earplugs because you wouldn't...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local councillor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides, it just depends. I don't know. They just come and go. I could eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, then I'm sort of like...
Having a good yawn?
I'm having a very good yawn. I'm making up for like the last 4 in one go.
Okay.
With the last 4 average yawns. I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good. And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods.
It's mostly cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call hot chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, if it was like 30 gobstoppers.
When you've eaten 30 of these things. When you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. So I don't eat a lot. I drink now and again. I eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
the cans are ongoing, right? But the thing is, going out for a session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day, 15 pints?
I'd go more than 10, but I wouldn't say I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
Yeah, I've just lost Lily. I think she might have gone to the toilet.
Oh, okay.
So she said, fine. I haven't looked because she's just been taking her weight and all preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Brenda.
I broke my leg.
No, that's
all right.
I broke my leg.
Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, OK? Let's bring you back down a little bit.
She's a very active little girl.
OK, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a serious. Like, there's more of them.
Can I have a little look in your nose? Is that OK?
Yeah.
Yeah? So, what's the longest without a nosebleed? A few weeks? A month, maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80. Just relax your nose. Don't scrunch it. Relax.
Is it going to hurt?
No, it's not going to hurt. I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating. What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, OK? 4 times a day for 10 days.
10 days?
Hopefully that will stop the nosebleeds.
Be sad. 94649.
Wow. It's just, we're happy. All right, there we go.
Lila,
Okay.
you've got to stop. You've got to stop now.
All right.
Thank you very much.
Bye-bye.
Come in.
Pleased to meet you, mate.
Hello. Please do all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take his way, can you?
You can't. What can we do for you today?
What happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after half an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, But he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor
That's right.
to have another examination.
That's right.
There we are. Well, we can sort that
around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know. Can they cure floaters?
No.
Kind of thing now. Instead of turning my head suddenly, I might get a little arc, light flash. But I've got a floater there now, but I'm kind of learning how to put up with this.
Yes. Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment. What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, Trotman. Thank you very much.
You have your tea, you're not drinking your tea?
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
When I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees?
Both knees. And
Elbows?
elbow. And when I do like that, when you do like that, and when
What do you mean?
when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, vision. You know, sometimes I get the vision. Sometimes, like, the light, not this kind of light, like the bulb.
Yeah.
The bulb, like a zigzag, but it,
A halo?
what is it? No, halo is round.
Oh,
This is not a round. It's like a zigzag.
okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe
Take-
slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't really, I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press
At the back?
right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the
Yeah.
edge for me.
like somebody was bashing me. Oh,
Right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much, a little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see how this one's there?
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cool. Feel my arm.
Oh yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
Right.
Why I wake up with this pain? What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50. So I think the way to do that is with a blood test today. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
No, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one? Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get it. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Sorry.
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I've cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator or the the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum. Because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah.
You're going to give it a go?
Oh, certainly.
OK, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me? Yeah. Thank you, sorry. I've got my colleague with me because his machine's working and mine's not.
How are you?
Okay.
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. Okay, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you stop, that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah. So the plan of action will be I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum,
Yeah.
will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on then.